Raise your hands if you're ready to turn back the hands of time without surgery. Ladies and yes, gentlemen, there are more tools than ever before to help us keep our skin looking young and vibrant. And this doesn't mean changing our look. It just means looking like the best version of ourselves. I like that. And I'm the first to admit that it might, just might, be time to consider correcting my facial wrinkles in a very natural looking way. I, like many women, have been uncertain about using cosmetic injectables, but the time has come to learn more about their benefits. Joining me this morning is Dr. Janet Allenby, board certified dermatologist from Delray Beach, Florida. Let's be honest, doctor, I can accept my age, but the wrinkles, it's hard. It's hard. And we are always in search of ways to slow the effects of aging and gravity on our faces. Daily sun exposure, stressors, environmental factors, genetics, and consistent use of facial expressions all take a toll on our skin. Sometimes, doctor, leading to wrinkles, sagging cheeks, and other giveaways that reveal our age. So tell me, more and more women and men, let's be honest, and men are using cosmetic injectables to, enhance the beauty. Why?
I think we all want to look as pretty as we can be, and sometimes as we're aging we don't feel like we look so pretty, especially with those women. And when you start making the face look more like we feel, the self-esteem goes up. We feel better about ourselves.
So this is what I've noticed in me, and I'm going to be completely honest here this morning, and tell me if you hear this, the frown lines.
Yep.
Really bothering me.
And they're really hard to accept, and it is usually an aging process, but it could just be genetics. Some people have a little bit more motion than others in their forehead where they have their frowning.
But what's happening to me?
Oh, I know, it's awful. What happens
It is.
What happens is we start getting these etched in lines. As the muscle is working, it actually etches the skin, and we end up having these permanent frown marks, and they're angry looking, and people don't like that look.
Here's another area that is bothering me as well. The smile lines, is that what they're called?
Well, everything around the mouth. I think when somebody's aging and they have a lot of problem with, like, their lips are deflating, or they have too many lines, like smoker looking lines, we also call them barcode lines. When they have those, it makes them feel old and they don't feel attractive. And I think when people are treated for this, they look better and it looks natural, and the key word is natural, and it's done well. They're really happy with their outcome.
So what would one use if you saw me, for example, and I tell you my frown lines and my smile lines? What could I do?
Olga, you are a perfect candidate for Dysport. Dysport is a prescription injection that is FDA approved for the temporary improvement in the look of moderate to severe frown lines between the eyebrows in patients less than 65 years of age.
And what about this area? This really bothers me.
Actually, smile really big, just a great, you have a beautiful smile. In my office, I use Restylane Silk. Restylane Silk is the only FDA approved product that is exclusively designed for the mouth area. It enhances the lip, it is going to fill in the little lines. It's a beautiful product that looks really natural, and particularly really natural on animation. So when you smile, you still have your smile, and it doesn't look fake.
Now, I know it's not a one-time thing, so let's talk about, let's say I went to go see you, frequency, maintenance, how much?
Typically, most people will come in, say they're doing their frown lines. When I use Dysport, it lasts up to 4 months. When I do something in the mouth area, when I use Restylane Silk, it can last up to 6 months too.
And cost? Because a lot of people, they're counting their pennies today, but I think something like this is worth it.
So the variation of price is really going to be depending on how much improvement someone wants. And there are some really great programs, such as Aspire with Dysport and Restylane Silk. It's a loyalty program. So when they're doing their treatments, they're actually gaining points, so it's going to help for future use.
And let's also note here that really when you're going to get this done, you need to go to someone that you can trust and someone that is certified to do so.
Well, we all know when somebody doesn't look good, and we want to have people that are trained. Board certified dermatologists, board certified plastic surgeons, facial plastic. In healthcare providers, there are a lot of injectors that are trained, and they are very talented. So you really want to research who you're going to. You want a natural outcome. You want to look good. Go to the expert.
And doctor, after your patients receive the procedure, they must come back and tell you they're so happy.
You know what? They're very satisfied, and it's a well-tolerated procedure.
I'm sold. So I know you're right down the street, Delray, so that's about a 15-minute drive for me. So expect me to be calling you and maybe making an appointment.
Oh, well.
Thank you so much, doctor. And remember to head to thebalancingact.com for lots more information there. And don't forget to follow us on Facebook and Twitter. Share your experiences with cosmetic facial injectables.
Dysport Abubotulinum, Toxin A, 300 units for injection, is a prescription injection for temporary improvement in the look of moderate to severe frown lines between the eyebrows, glabellar lines, in adults less than 65 years of age. What is the most important information you should know about Dysport? Spread of toxin effects. In some cases, the effects of Dysport and all botulinum toxin products may affect areas of the body away from the injection site. These effects can cause symptoms of a serious condition called botulism. Symptoms of botulism can happen hours to weeks after injection and may include swallowing and breathing problems, loss of strength and muscle weakness all over the body, double vision, blurred vision, and drooping eyelids, hoarseness, or change or loss of voice, trouble saying words clearly, or loss of bladder control. Swallowing and breathing problems can be life-threatening, and there have been reports of death. The risk of symptoms is probably greatest in children and adults treated for muscle spasms, particularly in those patients who have underlying medical conditions that could make these symptoms more likely. The toxic effects have been reported at doses similar to those used to treat muscle spasms in the neck. Lower doses in both approved and unapproved uses have also caused toxic effects. This includes treatment of children and adults for muscle spasms. These effects could make it unsafe for you to drive a car, operate machinery, or do other dangerous activities. Common side effects. The most common side effects are nose and throat irritation, headache, injection site pain, injection site skin reaction, upper respiratory tract infection, eyelid swelling, eyelid drooping, sinus inflammation, and nausea. Please see medication guide and full prescribing information for Dysport on dysportusa.com.